Please start by introducing yourselves, next following from outside the room, starting with yourself, Professor Lomas.
Yes, so I'm David Lomas. I'm Vice Provost Health at UCL, Head of the School of Life Medical Science and Head of the Medical School, and also Academic Director of the UCL Partners Academic Health Science Centre. And from the first of the year, I'm now the Deputy Chief Executive of the MRC.
Thank you.
I'm Martin Green. I'm the Chief Executive of Care England, and we're a representative body for care providers and have about 7,900 care services. We cover services for older people, people with learning disabilities, people with mental health issues, and also some disabled and support services for people with brain injuries.
Thank you.
Good afternoon, thank you for having me. My name's Danny Mortimer, I'm the Chief Executive of NHS Employers. We're an organisation that represents every statutory employer within the English NHS, so trusts, foundation trusts and CCGs. I also chair the Cavendish Coalition, which is a group of 33 health and social care organisations that are working together to consider the workforce implications of Brexit. Our members include Care England and the Association of University Hospitals.
If we can kind of ask you all about the impact of what's happened in the wake of the referendum, and particularly keen to know how it's affected the recruitment and retention of both NHS and social care professionals, and whether you've got any view on what the impact has been on in terms of the nature of public discourse and the impact on morale of people working in your sectors, and specifically whether you believe that people are leaving the NHS in the wake of the EU referendum result, and also whether you've seen a decrease in applications. So lots of different factors, but I'll come back if you don't cover them all.
So I think there's a few things there. I mean, I think the first, in terms of retention within the NHS specifically, we've put a huge amount of effort into seeking to reassure our EU colleagues and to stress the value that we place on the contribution that they're making. Their biggest concern is the lack of certainty, which you touched on at the end of your last session, and also some do report some changed behaviour and some unwelcome behaviour from the public in terms of their interactions with the public sometimes. We are seeing a decrease in recruitment. There are lots of factors going on there. Some of it is because employers haven't been out to recruit because of the lack of certainty. They'd like more certainty before they go back out to recruit in Southern Europe in particular. Some of it is because actually we're not seeing the volume of applications that we've previously seen. Some of it is because perhaps colleagues in those countries are making some slightly different choices. The feedback that we are getting, and some hospitals in the NHS have done a lot of work with their EU nationals. So Cambridge, for example, have done quite an extensive survey and series of conversations with their staff. They are, a number are reporting that the need for certainty and the lack of certainty at the moment is making them question whether they stay in the longer term. So they've stayed in this period since the referendum result, but they worry, slightly more of them are worrying about whether they should leave in the longer term. And some of that, I think, is related to the experience that Dr. Whitford touched on in terms of some EU national colleagues have made the decision to apply for citizenship or leave to remain, and that process itself has been counterproductive in terms of their experience, or and again, that was rehearsed very well at the end of the last session.
And have you seen that impact as a result of the immediate indicators that you referred to on vacancy rates? That data is not yet available.
I think it's too early to say in terms of that data being available. We have seen, and the NMC have reported, a lower rate of EU nationals joining the nursing register, for example. So that reinforces that some of the reports we're starting to get. We obviously recruit extensively outside the EU as well, particularly in nursing at the moment. So there was a sense, I think, in which we were having to start to look more actively outside the EU to find nurses because of the demand we have for those posts.
We're seeing a similar issue in social care, and in fact in social care there is the issue of the specialist services. So for example nursing, and they suffer the same issues that the NHS suffers. One of the things that I think hasn't been really well documented is as the pound slides and it gets more into parity with the euro, this is a less advantageous place for people to work because they can get on a train, do 2 hours to Germany and get pretty much the same. We also saw, and it's anecdotal, and Heidi, I appreciate there isn't the data behind this, but for example, one of my members had some nurse recruitment activity going on just after Brexit, and half of the candidates withdrew because they said they felt there was a period of uncertainty. So I think we're seeing at both ends, at the end of the specialist and technical support staff, that's being affected, but also the care staff are also being affected, and people are not deciding to come to the UK, and indeed other people are making decisions about whether or not they stay in the UK.
I think what our RCN colleagues were referring to is that registrations with the NMC, there is a greater component of those in the last 3 years that are from outside the UK, particularly from the EU, but also increasingly from outside the EU as well, as we sought to fill the vacant posts we have, particularly in nursing.
I think there's another issue as well, though, that there are some areas where it's very difficult to recruit, certainly in social care, and often people have come from the EU into those areas where it's been nearly impossible to attract candidates from those areas. So, for example, in some rural areas it's very difficult to attract people into social care, so EU nationals have gone into those services.
And for me, we're after a slightly different group. As well as the nurses and the professionals allied to medicine, so the radiographers, the physiotherapists, the OTs, which are really important, we're after the really high quality people that we want to recruit from around the world. So recruit from the EU, but also further field as well, so that we have the very best scientists to drive the innovation for the NHS.
Yes, obviously, Daniel, we're talking about there's been a drop in registrations. I mean, it's quite dramatic. It's a 90% drop from 1,300 a month to 101 in December. But that was already a halving from about 3,500 a month. So it's really huge. And while we've had a lot of discussion about, you know, protection for EU nationals here, is the turnover not about 25%, which means that, you know, gradually we could get into a position where more people are going home. We actually need a supply. It's not just the people who are already here now.
We do, and I know you're meeting regulator colleagues in future weeks as well. The system for getting entry is more complicated now than it was. It's harder now than it was previously, so it's language testing in particular, and there's some controversy around that. But no, absolutely, we do need that kind of supply. We do see turnover for EU nationals. People come for a period of time and return home to their own country. They come to a particular area and it doesn't suit them. They move then within the UK sometimes to work or return to their own country. So yes, we do. I think there has been for some employers there has been some reluctance to commit to large-scale recruitment within the EU, given the uncertainty that we've been talking about.
We need to feed a pipeline of research and development, and we need experts in order to drive the very best things that we do. I mean, we are world leaders in cancer immunotherapy, in cell and gene therapy, and regenerative medicine, and we need to feed that pipeline. Not all of them come from the UK.
We certainly have a problem in social care anyway, getting access to primary care. So in residential care, it's extremely difficult in some areas to get GP access for people living in care services. So anything which reduces the numbers of doctors that are available is going to be very difficult. And I think we should remind ourselves that people, particularly in residential social care services, whether they're people with learning disabilities or older people, have very great numbers of comorbidities. These are people who have very complex needs. So anything that reduces the amount of primary care support is going to have a big impact on our service users.
So in terms of the impact upon research and innovation, how would you characterise the impact of Brexit on that?
So there's huge threats for us going forward and huge uncertainty, and the biggest risk I think is the uncertainty, and when that's resolved I think things hopefully will settle down. But if we don't get the very best people, we don't drive our research and innovation where we punch above our weight. For the amount of money put into medical research, the outputs are far greater, so we're actually very strong and we have an international reputation for that. If we can't attract the very best, then we can't lead in the innovations that will lead to patient benefit. Because ultimately this is all about patients. This is about patients having the first access to novel therapies, devices, small molecules, biologics that they can't get elsewhere.
Okay. And you mentioned grant applications, EU grant applications and things earlier. Would you like to say a bit more about that? And I just wondered whether you had any reflections on what the Secretary of State told us when he gave evidence about the fact that it's very likely that the European Medicines Agency wouldn't be based in London following Brexit, and what your reflections on that are?
Yeah, so I think the EMA will certainly move, and that will be disappointing. I think there will be, you heard from Alistair Brackenbridge as well a few weeks ago about the fact that actually there may be delays in pharmaceutical companies launching in the UK because we're a relatively small market compared with an EU market or with a US market or a Japanese market. So we may be slower in terms to get the sort of benefits through to patients. As I said earlier on, we punch above our weight, and the figures I've got is that we raised €760 million of funding between 2007 and 2013 from the European Research Council. My own university at UCL and Cambridge are neck and neck for bringing the most money of any university in the whole of the EU. We are good. UCL has the highest amount of Horizon 2020 money in the EU, and that's £80 billion fund that drives innovation from the bench through to the bedside. So what would we like? We would like access to the European Research Council funding. We'd like access to the Innovative Medicines Initiative, to the Horizon 2020 funding, and to ERC fellowships.
We have got to find some mechanism to both maintain the staff that we have, but also to recruit more staff, because the problem that we have is that we have an increasingly greater number of people who need care and support. And one of our challenges is that all the processes to get people who are non-EU people into the country, or indeed post-Brexit, it might be the same for EU staff, are very complicated and very difficult and often linked to salaries. And of course, care workers do an incredibly good job, but they are very lowly paid. So what we've got to do is we've got to understand the needs of the sector and work through an approach which will enable the staff from the EU to be coming back into our services, because we desperately need them, because it is very difficult to recruit the numbers that we need from the UK population alone.